Being a good listener is one of the most powerful skills you could possibly have. And yet, very few people know how to do it. In an age of Instagram, TikTok, and YouTube, we focus so much on how we present ourselves, on how we communicate. But this is my question for you. How good of a listener do you think you are? If you've ever walked away from a conversation feeling that sense of disconnection, wondering what happened, or you want your relationships to go to a deeper level, whether that's personal or professional, or you just want to be able to have more influence in the workplace, then this is the video for you. Hi, if you're new to the channel, my name is Dr. Cara Bedzina. I'm an academic GP/family physician, and this channel is dedicated to all things medical education. In this video today, what we're going to focus on is how you can take your listening skills from good to great. Let's get started. Let's talk about the real issue here. Often when we're engaging in a conversation with someone, what will happen is one person will say something and then the other person will just say something else without actually acknowledging what the other person said. This creates a sense of disconnect. People want to feel heard, they want to be seen. And what we don't recognize is that even though we may be acknowledging what people are saying up top, unless we demonstrate that, it leaves the other person feeling unseen and unheard. And that is where the problem lies. Real listening isn't just about swapping anecdotes. It isn't just about recognizing or acknowledging the words. It's about understanding the meaning behind those words. And that takes skill. And it's actually a lot harder to do. But the good news is that you do not need a degree as a therapist or a psychotherapist in order to be a better listener. It all starts with creating a space that is safe and non-judgmental. Let's talk about how we can do that. Well, I've been a doctor for more than a decade and I'm a specialist in family medicine, so I mainly look after people in primary care. I also have a sub-special interest in medical education, and most recently I was the head of communication skills at a medical school. So I was responsible for all of the communication skills curriculum. And what I recognize is that a lot of people don't know that in order to be a great communicator, you need to be a great listener. And it takes a subset of skills that we actually don't often talk about, and yet they are so important. And why are they important? They're important because listening builds trust. Trust is the foundation for meaningful relationships, both personally and professionally. If a patient walks into a room with an issue that they want to discuss and they don't trust you, then you've got a problem. So let's start with my first top tip. Mirror what you hear. Often when we're engaging in a dialogue with someone, we can hear something that lights something up in our brain, and all we can think about is what we're going to say next. What I would like you to focus on the next time you're in discussion with someone is, rather than talking about what you think when a person tells you their story, I want you to focus on paraphrasing what they said and repeating it back to them. So for example, I'll give you a case where someone comes up and says, "Oh, my son has really struggled at school lately. He's failed his exams, and my daughter has actually been quite unwell." The way you would manage that is by repeating to that person, "Oh, I hear that your son is really struggling and your daughter's also unwell. Tell me what's been happening." Did you see what I did there? I paraphrased what was said without adding anything else other than, "Go on, I want to hear more." When we reflect back to people what they say, what we're doing is saying, I hear you. But it also provides people the opportunity to correct things. It's a really powerful tool that can be used specifically within the workplace, because often people are saying stuff and you might not actually be understanding the meaning behind their words. And so what it does, it allows people to go, oh no, I wasn't actually worried about that. This is the thing that's concerning me. So it's really important that we reflect back what people say to us. But I can guarantee you it's actually really, really, really hard to do, because you have to stop yourself and be present. But I challenge you to try this the next time you're in a discussion with someone, whether it's at home or at work, and see what happens, and keep trying it again and again. It feels kind of weird, I've got to admit it, but you'd be surprised as to the benefit and the way it helps enhance your relationship with that person. When you're doing that, you're saying, I hear it, I get it. So my second top tip is ask open questions about how this makes the person feel. I know what you're thinking. You're like thinking of like Frasier style psychiatrist going, and how does that make you feel? No, that's not what we're talking about here. What we are doing is giving the person the opportunity to talk about the impact of what is happening and what they're experiencing on them. So ways that you could do this is after you've mirrored back, saying, do you want to talk about it? Or, gosh, that sounds really difficult. How has that been impacting you? Like, what has it been like? Do you see how I'm giving space for that person to talk about their feeling without doing the typical, and how does that make you feel? I don't know why my accent went like this, but you know what I mean. What we're doing is we're creating space for those deeper discussions, those deeper connections. Now, sometimes, specifically within the British culture, this makes people twitch. Often, people are really grateful to have someone actually ask them how they're feeling and to talk about it. You'd be surprised how many times I've used this technique in really difficult conversations, and the patient has walked away saying things like, I have never met a doctor like you. And when patients say things like that, I know that actually they're feeling seen and they are feeling heard. So remember to create space for there to be an emotional discussion. Now, you do this by being able to sit in the discomfort, and that comes to my third top tip, which is resist the urge to provide unsolicited advice. This is my biggest bugbear. I recognize it's something that triggers me, so I'm very open about this. But people do not understand that the vast majority of the time, people do not want solutions. They are not interested in solutions unless they ask you directly for them. So what I would suggest is, as you start feeling uncomfortable with somebody's story, recognize that those feelings that you're having are your feelings. And often when we respond with advice, what we're doing is we're trying to make ourselves feel better rather than meet the other person's needs. And this is another thing I see people really struggle with. Now, the caveat with this is that if you have a very close relationship with someone and you know that they're distressed and actually you think that they would benefit from actually talking about different ways that they can move forward, you need to make sure that the person is open to that, is ready for that. So the vast majority of the time, my rule of thumb is do not give unsolicited advice. And you'd be amazed how this will improve the conversation. Again, once you try this out, it's gonna feel really weird. It's gonna feel really sticky, but I challenge you to give it a go. Go for a day where, unless someone asks for it specifically, unless of course you're a doctor or in another higher management position and people are coming to ask you questions, that's different. But in your just usual conversations where people come to you with things that they're upset about and they want to talk about, try and hold back from giving unsolicited advice and see what happens. My fourth top tip is make sure you're aware of your body language during the discussion. We talked about creating a safe space where people feel that they're not going to be judged. And we do this by asking questions, reflecting back, showing that we're listening. But another thing that we can do to create that sense of safety is by acknowledging and validating with our body language. Now, there are all these stats about this percentage of communication is via body language. I think I recently watched a TED Talk that completely discredited that. But the moral of this story or lesson is that a lot of how you communicate is with your body language. Now, in the situation where you are engaging with someone, you're having a conversation and they're talking, one of the things that you could do that's so subtle and yet so helpful is just to nod while someone's talking. I've seen some behavioral analysts and psychologists talk about the 3-head nod. I think you don't need to think about whether you do it twice or 3 times. Do what feels natural in that case. Often it's keeping your hands held together. I usually hold my hands or sit on them. And what I do is I nod my head and sometimes provide verbal cues that don't interrupt the flow of the conversation. So I do things like go, And what I'm saying is go on, keep going. You would be surprised how this improves your conversation, your communication. Because what it's doing is that subconsciously you're telling that person, keep going. I'm here. I'm listening. You are safe. You are heard. You are seen. It's something so simple and it can make a massive difference. Finally, this is my final top tip. I've lost count here. I think it's number 5. We'll see. Let's say it's number 5. I do plan this, but sometimes I add tips in between. So my final tip, if this is number 5, is do not be afraid of silence. Something I've come to recognize in myself is that for a long period of time, I thought the fact that I was really bubbly and chatty and gregarious was a marker of my social affluency, the fact that I was a bit of a social butterfly. And yet, as I've been on a personal development journey, I've recognized that a lot of the times I try and fill a space, fill that gap, because I'm feeling quite nervous, I'm feeling a little bit worried or anxious. And what I've gotten better at over the years is learning to sit and let silence be there and not being afraid of it, especially when somebody has talked about something that's really difficult and really hard. What it does, it allows space for the both of you to sit in what's just been said. But also, if the person wants to continue talking, they can use that space to do so. I love a tweet. It was either a tweet or a post that Adam Grant shared, and I'm not sure what the original citation is, but he talks about the fact that the most powerful gift you can give someone is attention. And I think that's so true in the busy world of today, where people are swiping through things, looking at things for a minute at a time, 20 seconds, whatever. What you can give people is time. And if you've already done the steps that I've mentioned, then you're already doing better than most people when it comes to being present in a conversation. But being able to sit in silence and being comfortable with silence is such a powerful tool, especially clinically. Like, this was something that I learned from some palliative care doctors that I worked with when I was on placement. And so palliative care physicians, they're usually specialists in caring for people in the end stages of their life. Often when we think about the end stage of their life, we think of people on their deathbed, but people can be palliative and live for a considerable amount of time. And often they're living with quite complex pain, with a lot of psychosocial issues and other difficult and complex matters. And I watch these palliative care physicians sit in silence and not try to fill the space, not try to express that they actually understand what the person is going through. And you wouldn't believe how powerful that is. Right, I think that's more than enough for today. There are lots of other different ways that you can learn to be a better listener. What did you think of the tips that we talked about? Did any of them resonate with you? Did you recognize techniques that good listeners in your life use? I wonder what you think. If you've enjoyed this video, be sure to subscribe for more content like this. If you have any ideas of other topics I can tackle, or if you have questions about how you could improve your skills as a listener, pop them in the comments below. I also have a bunch of other videos around education / developing your skills that are all embedded in evidence and my experience as an educator and as a physician. Thanks for watching. If you made it this far, that's so awesome. I'm really, really grateful because like I said, the most powerful thing you can give someone is their time. So I'll see you next time and have a good one. Take care. Ciao.